The Herriman Emergency Center is a full-fledged ER. We have our board-certified physicians. We have short wait times. We have 24/7 CT and X-ray available. We have a full lab, and that's just in our neighborhood backyard here.
Welcome to Herrimanology.
The official podcast to keep up with Herriman City.
We'll take you inside the city, explore the latest news and updates, show you how your government operates, and discuss the issues that affect us all. Now, here are your hosts talking all things Herriman on Herrimanology.
All right, welcome to Herrimanology. It is Tuesday, July 9th, and we're talking about the Herriman Emergency Center today. I'm pretty excited about this. A bit of a, I don't want to say unique podcast. Normally we keep it to city updates, but we wanted to feature the Herriman Emergency Center just down the road from where we are here at the City Hall. But it's a neat, I guess still recent addition to the community, but you've been here for a little bit.
Yes.
This is Brittni Clark. She's the manager of the Herriman Emergency Center, which is a part of the Lone Peak Hospital.
Yes.
And the Lone Peak Hospital is part of the Mountain Star Health Network.
Yep.
Healthcare system.
Yep.
I'm going to say that wrong. But, I'm John LaFalle, Communications Manager for Herriman City. Thanks for coming in. And
Yeah, thanks for having me.
what is the Herriman Emergency Center? For someone who isn't familiar with this location and only thinks of hospitals as big, gigantic things.
Yes.
Maybe describe what the Herriman Emergency Center is and kind of what the services that you offer there.
Yeah. So the Herriman Emergency Center, we opened up in October of 2022, and it is a full emergency room department that just doesn't have the hospital connected to it. So you just have the ER, which is a great resource for a fast-growing community like Herriman, because a lot of times you just need an emergency room to stabilize and kind of figure things out and then kind of go from there. And the great part about having one so close to home in the neighborhood is that we have short wait times. We can get you in and out in a convenient time. We have 24/7 CT and X-ray available. We have a full lab, board-certified emergency physicians, and very skilled nurses on hand 24/7. And that's just in our neighborhood backyard here.
You can pack a lot in there because it's not a tiny building, but if you're used to looking at hospitals, it looks like a small facility, but you pack a lot of punch in there, so to speak.
We have a 10-bed ER, a trauma bay. So if there's a very sick person who comes in, we have all hands on deck, and we can do anything from intubating, doing CPR, to suturing up lacerations. So we kind of get a mix of everything.
So this is the first facility of its kind, really, of any type of emergency healthcare in Herriman's boundaries. Mm-hmm. What was the reasoning for putting this in Herriman? What was the need that was identified beforehand, and maybe why Herriman?
Why Herriman? I would say it's because we saw a need that, Herriman is a community that's quickly growing. And so there wasn't really much healthcare within this area. And so having that available with the rodeo that we do, the amazing food truck events. We do a lot of events here in Herriman, and having that healthcare just right down the street in case of an emergency really was a need of the fast growing city.
Yeah. And speaking of those events, the Herriman Emergency Center and Lone Peak Hospital in general has been a sponsor multiple times of Herriman City events. Why is that a priority?
We want to get back to the community.
And we're happy for it, by the way. We love it.
No, we love our community. We offer free classes every month. I teach Stop the Bleed at the Herriman Emergency Center every month. My amazing coworkers teach hands-only CPR. If there's a class or a want that we can meet that need, we're more than happy to bring that to Herriman. That way you don't have to travel across the valley maybe to get that certain class that you're looking for. We love sponsoring, just being involved with our events and being upfront with it. We like to show up for our community and be a great partner in our great city.
What are some of the things you see most frequently there?
I guess it just kind of depends on the year. If you're out doing stuff, we see a lot of like mountain biking, bicycle accidents, car crashes. But then towards, winter time, we see a lot of flu, RSV. Unfortunately, COVID is ramping up again. And so we're starting to see more of the respiratory illnesses as well.
Any seasonal health tips, whether it's a simple reminder or something that people may not be thinking of?
I would just say, make sure you're washing your hands. If you feel sick, stay home or wear a mask. Like I said, unfortunately, COVID is starting to reappear, and it's just taking care of yourself and your family before and helping stay clean and
good hygiene,
yep.
Staying safe, just making good decisions.
Wearing the helmets when you're riding your bike, and it's just wearing that seatbelt in the car crashes, and just the simple things that some people tend to overlook that can really help.
Going back to some of the classes that you're offering, this is something that I imagine there's more room for people to take advantage of. How can people find information about some of these classes or some of these demonstrations? And participate in some of them?
So to see what types of events or upcoming events that we have or classes, you can go on to the Lone Peak Hospital Facebook page. We like to publicize them there. Or you can go on to Lone Peak Hospital's website and click on classes and events. And we have them there. You can type in Stop the Bleed or CPR, and it kind of links you there. They're great keyword search. And if there's something there that you may not see, maybe that's something that we could put on the docket for an upcoming event or something if there's a lot of need for it.
A couple of questions people might be wondering: how frequently are those types of classes offered, and how much do they cost? Yeah,
we kind of go every other month. So in August, we'll have Stop the Bleed, and that's completely free to the public. You just go on and register on the Lone Peak website. And then in September, we'll do a hands-only CPR training. You don't get certified with that, but it goes through the motions of what to do in case of an emergency and going through hands-only CPR. Also completely free to the public. We know that cost can be a big deterrent, but these resources that we're teaching the Herriman community help save lives. And so if we can save just one life by a class, then that's worth every penny.
You never know when you're going to need this type of education, whether it's, I'm thinking Stop the Bleed specifically or CPR, but you never know when something's going to come up. You want to be armed with that knowledge, and to have this service right here free of charge, that's a big deal.
Yep. Our classes, we like to keep the numbers a little bit down just so that you have that opportunity to ask questions and get that teaching, that hands-on teaching. But for CPR, we do multiple classes in a day if we need to meet the needs of what our community wants. And we've had great feedback from those classes. And so we're excited to keep offering them.
So for people who are used to maybe the larger facilities and surrounding communities aren't used to going to a facility of this type, how would you help those people? How would you respond to that?
Yeah. So the Herriman Emergency Center is a full-fledged ER. We have our board-certified physicians. Our nurses rotate between the Lone Peak ER and our ER. If we determine you need to be admitted to a hospital, we'll start treating you, and then we will admit you to your preference of the hospital that best fits your needs. Like I said, we're a department off of Lone Peak, and so our preference is the Lone Peak Hospital is where you would be admitted. But if you need to be admitted elsewhere for care, then we are more than capable of transferring you to a different hospital as well.
And if you're going to the Lone Peak Hospital, is there some sort of connection there that may be advantageous?
So if we're admitting to the Lone Peak Hospital, then it's an ambulance ride. It's like one big hallway. We just admit straight to Lone Peak and get you the care that you need to help you feel the best you can. We are a stroke receiving ER, and so time is brain. If you're having stroke-like symptoms, you lose balance, slurred speech, your arms are weak, you can come to the ER. We initiate a stroke alert, and being a part of the Mountain Star healthcare system, St. Mark's is our comprehensive stroke center, so we're already in ties with them and can get that care faster. We get the process started to help save that tissue that's being disrupted by that stroke and can get you that definitive care quicker rather than waiting in an ER to be seen.
So safe to say, if somebody has an emergency situation, they can come with full confidence to the Herriman Emergency Center. If it's something that escalates beyond the care that facility can provide, there's plenty of backup plans and you're ready to take care of those people.
Well, that's the great part is we have great resources, not only within Lone Peak, but as part of the Mountain Star healthcare system, we have amazing resources from Timpanogos and their pediatrics and St. Mark's and the cardiology, Lone Peak and their amazing surgery services. We kind of hit it all within the Mountain Star healthcare system. And so having a Herriman Emergency Center here in our neighborhood helps expedite that process. So if you're feeling like you might have appendicitis, we can start that workup. If you don't, then here's where we need to get you feeling better. If you do, then let us help you, and we'll take care of getting you to the right place to take care of that.
So in an age where construction is just terrible and people are getting increasingly annoyed with traffic, you don't need to go to another city to get your care started. You can go right here, just off 134th South, and I believe that's Fort Herriman Parkway.
Yep.
The exact coordinates might be a little bit different, but that's probably how people are going to find
right
it.
Right behind Walmart Marketplace.
Yep, just southeast of the City Hall. There are a lot of ways to get there.
Yeah.
Nice and convenient.
Yep, and if we do have that critical person who needs to be transported out of the emergency room quickly, we do have air transport available that can fly them to the definitive care of what they need, whether that be any type of facility or hospital.
Small facility, small but mighty.
Yeah.
And it's super convenient. It's right here. Hopefully you don't need emergency care, but at some point pretty much everybody does.
Yes.
So of some type. So I would say if you're listening or watching and you haven't seen the emergency center, probably take a quick drive over there and make sure you know where it is, and hopefully you won't need it, but if you do, it's right there.
Yep, we're always there for you.
Plus, you can always go to the classes too, even if you don't need emergency care.
Yep, we do offer those.
So if people want more information about the emergency center, you mentioned social media. What's the website? Maybe what's a phone number? What's the best way for people to reach?
So you can go online to herrimaner.com, and that'll get you all of the information in regards to the Herriman Emergency Center, and then to look at classes and different offerings that Lone Peak and us offer. It links you right to the Lone Peak Hospital website, and so you have all of that at the hands of the keyboard.
There you go. Herriman Emergency Center, right down the road from where we are, right down the road from wherever you are.
Yes.
Assuming you're listening from Herriman. Thanks, Brittni, for coming in.
Thank you.
We're excited to have the emergency center. It's, like you mentioned, it's been about a year and a half, but it still kind of feels new.
It does, yes.
But it's super happy to have you here and those services for our community. It's a big asset. So.
Yes, thank you. Thank you for having me on here today, and yeah.
All right. Well, thank you for listening and watching, and we will catch you next time.